and a little bit of neuroscience for this Saturday morning. Nicotine mimics a neurotransmitter called acetylcholine. And that's one of the things it does, is that it increases activity in pathways called our cholinergic pathways in our brain. So it can cause us for a short time to feel more energized. Also affects our dopamine pathways, which is our reward center. So we feel good and then we get addicted. And it's a very, very powerful addictive drug, just as addictive as other drugs. We always think of things like cocaine as heroin as harder, but nicotine can be just as addictive as them. And it also affects lots of other neurotransmitters, endorphins. It can affect glutamine. It can affect a lot of different things in our brain. It changes our brain, which is why it's so damaging for children to be exposed or to start smoking early. Little bit about vaping. Vaping is the new kid on the block. So it's either using e-cigarettes or vape pens to inhale nicotine, and it's flavored aerosols, so it makes it a lot more attractive. There's been a massive increase in its use, especially over the last decade. And they're better devices, there are lots of colors, lots of attraction, and better flavors as well. There's a really worrying rise in children, especially teenagers, using vapes. It's seen as the new cool thing to do. And it is thought to be a better alternative to smoking cigarettes. So it's thought to be less, have less chemicals. But we don't have the long-term evidence. And I believe we'll be seeing that actually a lot of harm is caused from this with long-term use. If you're using it as an aid to stop smoking, the aim is to stop vaping as well at some point. The nicotine addiction in itself is very harmful, especially to that developing brain. Remember our little neuroscience lesson just now. It's really harmful, and it makes it so much more difficult to give up a bit later on. The new thing, I saw a respiratory consultant giving a talk the other day on the news. Lung injuries from vaping. We're seeing it in our hospitals and in our outpatient clinics and in our GP practices more and more. And that chemical exposure can be significant and lead to harm. I want to talk a little bit about passive smoking because we forget about passive smoking. So people can still smoke in their homes and in private cars. I'll talk a little bit about the law in a minute. So we can be exposed to smoke, which is harmful to us in this way. And our children are particularly vulnerable to this. It struck me, that image of the boy. It says there that if you smoke around your child, he can inhale the equivalent of 102 packets of cigarettes by the age of 5. And that's even if you're smoking outside and then coming in. That smoke can cling to your hair, to your skin, to your clothes. It can worsen lung conditions like asthma in children and can lead to those significant health issues I've also already mentioned in their later life. So we need to think actually passive smoking is really a problem, even if, like I said, you're smoking outside or you roll down or open a window. Smoking and the law. So this picture reminded me of, I'll tell myself now, my age, of the days when I was back in the day when you go out with friends to a party or to a club. I always had braids. I was always in braids back then. And you'd come home and everything, your hair, everything would just be clinging. Smoke would just infiltrate everything because it was normal to smoke in the clubs. But it's a completely different day now. It's been illegal to smoke indoors since 2007 in England and 2006 in Scotland for a long time now. So you don't smoke. You don't come back with smoke clinging to your clothes when you're in an indoor space like that. And then since 2015, it's actually illegal to smoke in a car if a child is present. There's been a big plan. Rishi Sunak, I believe, announced it last year, and it's going through Parliament. It was introduced end of 2024 in November, currently making its way through Parliament. So the aim is for no one born after the 1st of January 2009, so about 15 or so at the moment, to ever be able to buy tobacco products. And there's a few other laws they're hoping to bring in place because they want to make a smoke-free generation. And I really like this quote from Professor Whitty. He's talking about a smoke-free country would prevent disease, disability, and premature deaths for children born today and for people long into the future. Smoking causes harm across the life course. It can cause stillbirths, low birth weight as well, asthma in children, cancer, stroke, heart attacks, and premature dementia. Most smokers that are smokers today wish they had never started, but they are trapped by addiction, which is powerful. Secondhand smoke, so that's the passive smoking, causes harm, including to children, pregnant women, medically vulnerable people. So reducing that secondhand danger is really important. If vulnerable people can smell smoke, they're inhaling it. The rising number of children vaping is a major concern, and this bill will help to prevent the marketing of vapes to children. And we don't want that. We can't have, in the same way we need to stop junk food advertising to children, we need to stop the vapes being advertised with the colors, the lovely flavors, all of that. It needs to stop. So this is a major piece of legislation that is planned. And if it's passed, it will have a lasting impact on the health of the nation. So I thought that statement was quite powerful from our chief medical officer. So with all this, all these dangers, the stigma, like I talked about, why are people still smoking? Why is it attractive to some? So the physical and mental addiction of smoking and the nicotine is very real and very difficult to overcome. There's social pressure and peer circles. If your parents smoke, it's more acceptable to you to smoke. If your friends and those around you smoke, you're going to feel that that's the normal thing to do. People do still enjoy it and believe it can help with their stress. So I see patients all the time who are maybe having other issues, mental health concerns, other life stressors. And when I bring up giving up smoking, oh, I can't possibly do that. I'm too stressed as it is. So people, that initial thing, remember I said it sparks off lots of neurotransmitters in your brain. It does initially make people feel good, but we know in the longer term, it can actually worsen things like anxiety, depression, and stress. So it is good for you to stop it in the long term. And many want to quit. Like we said, most adults actually who smoke wish they never started, but they may find it hard to access support. And I think there's still a lot of stigma around accessing support that we need to tackle and reduce. So some of the NHS smoking services to help you quit. There's lots of help out there. So in your local area, wherever you are across the UK, so England, Scotland, Wales, Northern Ireland, there are local stop smoking services with stop smoking advisors, and these are free. And it really increases your chances of stopping smoking once and for all. Addiction is like a condition, it's like a disease. We need sometimes medication and help to help us overcome it. So some of the interventions include counseling. You can have that one-to-one or group sessions. They will usually start with a breath test to check your levels of carbon monoxide, which is one of the chemicals in cigarette smoke. And they can measure that over the course of your stopping smoking program. And that helps with motivation as well. Nicotine replacement therapy. I'm asked to prescribe this every day when I'm at work. And this comes in the form of patches, gum, lozenges, inhalators. And because a lot of people say it's the physicality of actually inhaling something that helps, but some do very well on the gum and the lozenges. And the idea is that you start with a higher dose of nicotine and you gradually come down as you wean yourself off. So e-cigarettes or vapes are actually not available on the NHS, but a lot of people are using it as a way to stop smoking. The issue is people keep vaping for long periods of time. So I think that it needs to be part of a program. So you can still get advice from a trained NHS stop smoking advisor, even if vaping is the way you're choosing to try to stop smoking. Sometimes medications advise. So there's one called, it used to be called Champix, varenicline. So it's a prescription only medication. Your GP or a prescriber will have to prescribe it. And it works as it acts on those neurotransmitter, one called a nicotinic receptor agonist in your brain. So it helps to reduce those nicotine cravings. And one course lasts 12 weeks. And the helpline there is a smoke-free national helpline. That's the England one. The link there, if you go to NHS Stop Smoking, put that into any search engine, it will take you to the NHS page, and the helplines available in England, Wales, Scotland, and Northern Ireland. So some of the healthier choices. And as I'm talking to you, as always, I'm talking to myself. This is something that all of us are in together, and we are really stronger helping each other. So smoking, everywhere we go, everything we have, whether we're pregnant, whether we have a chronic condition, whether we're trying to lose weight, whether we go for our NHS health check, if you're a smoker, we should stop smoking. And you can ask for help. I really want to encourage anyone listening who's a smoker. Some people can do it, go cold turkey and stop just like that, but it isn't easy to do. So ask for help with this. This is something that we should be encouraging people to just seek help. So stop smoking. And if you are exposed, increasingly as a doctor, we're asking in our history, are you exposed to smoke? So if you're exposed to passive smoking in your home or in your workplace, then there may be strategies to try to encourage you to not be, in terms of speaking to that person if it's a relative and giving them help and advice on how to quit. Eating well, we want to eat the rainbow. So different colored foods, our greens, our oranges, our red vegetables, our purple. We want to eat the rainbow: vegetable, good quality fiber and protein, carbs in moderation. And we want to eat whole foods, so avoid the ultra processed foods that we're increasingly exposed to. We want to reduce alcohol, so drink in moderation. Some are big feel that big benefits from not drinking at all, but if you're reducing right down, that is of benefit. And stay hydrated with water. Really drinking enough water a day. That was one of my mother's big thing. Have you had enough water to drink? And it is good advice. Move. So we all need to move more. We're not meant to sit at tables all day or lie down. We are supposed to use our legs. And it doesn't have to be big exercises or in a gym. Start small, but do something that you can build into your consistent daily or weekly activities. And walking, simply walking daily and getting enough steps in goes a long way to improving our health. Build our supportive social services. We're built for fellowship. We're built to be there for each other. We're built to pull each other up and support each other. When I'm down, you help me. When you're down, I help you. So build your supportive social circles. And I heard a talk recently that talked about you have your deal friendships, because people talk about your network and it's your net worth and all this, but those are kind of deal friendships that help you get somewhere. But actually, we want to maintain and nurture real friendships. You may not really have anything, to offer them, but you know that person has your back, is there for you through thick and thin to support you. So maintain and nurture those real friendships in our family and in wider social circles with friends. Friends of old. I'm really privileged to have friends from school, from childhood, but also be open to new friendships because there's always magic and joy out there. And work, whether it's voluntary work, whether it's work at home, whether it's work outside the home, whether it's a career or profession, do work that brings you meaning and purpose, and look for that in any of the work you do. And when we're giving out of ourselves, it really makes a difference. So all of this can help make us healthier in terms of our whole selves, not just our physical selves. So thank you for listening. Together we are stronger. It's really a big encouragement to seek for help. Don't feel stigmatized. And there is definitely hope and healthier lives out there.
Thank you so much, Dr. Ogi. That was wonderful. I think everyone left with information that they can use on their daily lives, perhaps share with a friend. So that was really, really important. Thank you for that. Made it really relatable. I think Dr. Itunnu is here now.
Yeah, sorry, I can't start my video. I've had to change device. I apologize. So I can't start my video. I think someone needs to let me. Yeah, thank you.
I've made you co-host, Dr. Atun.
Perfect. Thank
Just
you. Can
yeah,
you
if it share
see
your
me
screen,
now?
I'll spotlight you as well. Just give me 1 second.
You're back. We can see you.
Perfect. No, that was a fantastic talk. And I really love about the non-stigma. And
Yeah.
remembering that even though there's a lot of, you know, uh, societal stigma around it, we've got to break that down because at the end of the day, it's about getting help
Yeah.
for stopping smoking and other sort of habits that can impact our health, which is,
Yeah.
really what we need. So, Dr. Oge, you've spoken about how you can get services from the NHS stop smoking service, and you've gone through all the different options for treatment. But okay, say for example, and whilst we're waiting for questions from the audience, say for example, I've been smoking for 10, 15 years, and I come to see you in clinic. How would we have this conversation?
So it's a first stop of, I think everyone has to really examine their why. So why is it? A lot of times you go to a doctor, you expect us to tell you, you need to stop smoking. You expect it. And people know, I know, they don't even want to answer the questions sometimes, or
Mm-hmm.
they always underestimate how many cigarettes they smoke. Or the people, my favorite, my personal favorite is those that come in, they've got a cold, they've got a really chesty cough, listen to the smoke, it's part of the history. You ask, do you smoke? No, I stopped smoking when I got this cough last week, and they proudly, and I'm like, well, it's a point, it's an opportunity to encourage, well, try to keep it up in terms of stopping long term. But if someone has been smoking, it's really to examine, and that's where those non-smoking advisors really come into their own, because you need to examine why. And even if you don't think you're ready to quit, I'd still encourage you to seek the help of a stop smoking advisor, because they can examine your why. What is it? What is it you're hoping to gain from stopping smoking? There was a diagram I saw that showed the timeline of benefits of when you feel better. Some people say they feel worse because that initial uptick they get may go, but then in the long run you definitely get better. You may find you can walk for longer, you can do the exercises, you can run around with your kids. So it is really breaking down your why. Of why is it that you want to be healthier for yourself, or usually it's for other people, a family member, a child. But once you know your why, you're more likely to then make a plan to then take your steps towards quitting. So most people are advised to set a quit date at a certain time ahead. And maybe you need those adjuncts like the nicotine replacement therapy or the medication to assist. That's why I say talk to one of these trained stop smoking advisors, and they can help you make a plan that is sustainable and that will take you step by step through the process.
Thank you so much. And speaking of why, we do have someone with lived experience who's here
Mm.
to share her story, and she can tell us about her own journey with stopping smoking and her why. So we've got Grandma Sheila here with us. Thank you so much, Grandma Sheila. So can we have Grandma Sheila spotlighted, um, please?
Yeah, she's there.
Perfect. So, Grandma Sheila, thank you so much for being here. I just absolutely love that you are here to share your real experience. So, do you want to just tell us about your stop smoking journey? What happened for you? What was your why, and how did you get to stop smoking?
Oh, first of all, I started smoking, I think, when I was about 18. So I smoked for a very, very long time. And I think when you're a smoker, you become a bit selfish. You don't sort of look at the effects it has on other people, to be honest. But about 4 or 5 years ago, I had become a Christian, and I felt that smoking and being a Christian doesn't really go hand in hand. So I made an endeavor to really try and stop it. Um, I went to uh, stop smoking clinics. I did everything, including vapes, patches, everything. Nothing seemed to be working. It was a real, real struggle. But
Mm.
when I started to really pray about it, because I felt that that was the only answer for me, was to really pray about it and just to stop, without, they call it cold turkey, just to stop and not smoke again. And to be honest, that is exactly what I did. And I've not smoked a cigarette for over 5 years now. So
Amazing.
Wow,
Amazing.
amazing. And can you just tell us, what did you have a why?
I think maybe it was because of I felt that it conflicted with being a Christian. Yeah.
You did
So
mention that.
yeah.
Um,
So and
so how,
also
yeah.
I think it was impacting on my health because especially my breathing. As a child, I'd grown up with asthma. So occasionally I used to get have a bad chest, I called it. And all this was because of smoking, so I just didn't want it anymore. So, but
Thank you so
I must
much.
say it is very, 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 very difficult. And you have to be really determined and actually make that decision to stop. It's up to you. I know it's an addiction and I know it can be difficult, but I feel that if you put your mind to it, if I can stop, anybody can stop.
Mm.
Hmm. Hmm. How
I mean,
powerful.
yeah.
And how many years did you smoke for in total?
Well, I'm 70 now, so over 40 years.
Wow.
Yeah.
Wow. Wow. So
I know
you,
all my friends smoked.
Yeah.
Even all the years I lived in Nigeria, I smoked. Uh, I came back here, all my friends were smoking. It was, I don't know, was it a trend or sometimes I think it's because of loneliness. In this country, you can be on your own
Mhm.
and things like that. So, smoking, uh, stress, all those kind of things, when you're worried, all those kind of
Yeah.
things. So, that's always the excuses to smoke. And I can understand why people smoke because being an ex-smoker myself. But if you can be determined, it will be hard the first couple of days, the first week or so. It will be hard. You will have those cravings. But once you get past that first 7 days of not smoking, that's it.
that's amazing, honestly. Just, after decades of
Yeah,
smoking, you were
yeah,
able to break free. And
yeah.
I think someone else has shared about their father as well, who'd smoked for several decades and then became unwell. And then after 40 years of smoking, dropped it, and he's now not smoked for 10 years. So, quite similar to your story. So, some people like you are able to do that cold turkey, which is incredibly difficult. Other
Mm.
people will need more support. I think statistically, it's said that it's easier with support, but it's
Yeah.
amazing that you were able to kind of do it. Just, and you obviously had a why because you felt it conflicted with your faith. So thank you so much for sharing your story, Grandma. It's really inspiring, I think, to a lot of people. Did you have something to share, Dr. Oge?
Yeah, no, it's, I was just saying she had support. She had the Holy Spirit in terms
Oh,
of her
yes.
faith, So whichever, I mean, and it's not just one thing, and it's not one size fits all. Everyone is different. Everyone will have a different why, and that was a very powerful why in her case. And ultimately, she went through some of the process, and that was what it took in the end for her. Someone else has put in the chat that her dad stopped smoking after he had a health scare. So sometimes that's what it takes. You're diagnosed with that condition, and that is the litmus test to then say, no, I need to now make a change. Some people say they stopped smoking. A lot of my patients told me, who are ex-smokers, they stopped smoking when their children were born, or when they got pregnant. So it's about examining your why and then asking for help wherever it may be, physical or spiritual help. All
Yeah.
is
All,
acceptable.
all is accepted.
Yes.
Absolutely. Yes, thank you for pointing that out. Someone's
Sorry,
asked, speaking oh, sorry, Grandma, you were
can
gonna
I
say
just
something.
say how expensive cigarettes are? I mean, at the
Mm,
moment, I understand they're about 15, £18 a
Yeah.
pack. Wow. I was smoking like 20, 30 a day. I mean,
Yeah.
I think I'd have to be very rich to be smoking now.
And it's
It's an
true with my
expensive
health.
habit.
Absolutely, really good point. With my health inequalities hat on, and we know from the data that a lot of the more deprived socioeconomic groups are heavier smokers. So you
Mm.
know that that is money that's going elsewhere, but it is much more difficult to break that vicious cycle. But when you add up, which is why getting the support and realizing that you can get the support, and you can get support on prescription as well. So it can really be hopefully a motivator to really stop, because it is extortionately expensive. But addictions, like anything, there's a reason why, there's a reason why it's a multi-billion dollar industry as well. It is preying on very clever way our brains work, and there's a reason why it's so addictive and so lucrative, basically, in
Yeah,
terms of the tobacco industry. So, but the money that's saved, absolutely, if people can really, that's another why as well, that some people say, I
yeah,
really couldn't afford it, and I needed to do it to do something else. So that may be
that's
another
right.
reason to really think about it.
Fantastic. Someone's asked a question. You were talking about, when people get pregnant, and they said, I know that smoking makes the placenta gritty and ugly in pregnant people, but can nicotine pass through the womb through the mother to the baby in her womb?
Yes.
Absolutely, it
Yeah.
can. And then sometimes it's more concentrated, because that placenta blood barrier is so effective at getting, the idea is to get nutrients to a exponentially growing baby. So nicotine absolutely travels through the placenta barrier to baby. It's thought that babies are born, it can affect their birth weight, it can increase the risk of things like stillbirth. But when babies are born, they can be, that nicotine addiction can be real for them too, actually. So they can be more irritable, have more issues in those early months. So it is really crucial that pregnant women are given all the help to try and support. Ideally, stopping before conception is the ideal. But some people find out they're pregnant, and it can be another motivation to stop then. But it can cause harm and can definitely get to the baby through the placenta.
Thank you so much, Dr. Oge. We have a few more questions. Someone's asked, what are some of the chemicals found in cigarettes or vapes that surprised you?
So I saw a diagram, actually. I wanted to share it to see if I can find it. So tar is the one in cigarettes mainly, but then in vaping, there's another. Let me say it is on my phone. So my speaking, Dicotel. Do you know the name?
Mm,
Dicotel. There's lots of different. There's so many. I mean, cigarettes. They say over 7,000. You can never list all that 7,000. But vapes in itself has lots of chemicals, and they're always improving it. So some of them: tar, nicotine, taurine, formaldehyde, lead, ammonia, arsenic, tad, formaldehyde. It goes on and on as such. So there many, many, many. And we know arsenic is bad for us, yet many, people still inhale it in cigarettes still.
Especially the illegal cigarettes, because obviously some people are trying to save money, and so they buy illegal vapes or cigarettes, and those
Mm,
things contain even more harmful chemicals. So it can really be very detrimental to your health. So someone's asked, what do you think the government or schools should be doing differently to prevent youth smoking or
mm.
vaping?
So I think that this new tobacco and vapes bill is going a long way to trying to address it. It's a bit of a catch-22, because the government gets a lot of revenue as well from the tobacco industry in terms of duties or tax. So there's always this, you wonder whether or not they're fully behind really stopping it. But the law has, I think one of the biggest public health measures was banning smoking indoors. That in my lifetime has changed behavior drastically. So the government, with this new tobacco and vapes bill, are trying to put things in place that mean there's a whole generation of children that will, there's always stuff that will become illegal. You could always get illegal drugs, but it'll be a lot less. That's the idea, compared to the numbers we're seeing now. And when it's not, it's already less acceptable to smoke, I would say, since the smoking indoor ban. But when it's now, you can't actually buy it anymore legally over the counter, I think that will go a massive long way if that legislation is passed.
Thank you so much. And I think whilst we're talking about smoking cigarettes, a few people have mentioned about smoking cannabis.
Mm,
And people have talked about, our community where it's quite rampant, and also links to mental health. And then
yeah,
another person has asked about, but some people say smoking weed can help as a painkiller or as a
yep,
treatment for certain
yep.
conditions. So I think it's just kind of, let's have a conversation around smoking cannabis. So what I was going to say was, I remember as a medical student discovering that smoking cannabis in young people of black uh, extraction, so African or Caribbean extraction, some people have a genetic predisposition that if they have smoked cannabis before a certain age, then they're more likely to develop psychosis
Yep.
in the future, and serious mental health problems. Yet, in our community, I don't know how many people are aware of that, but it's quite rampant, especially around our young people. And it's very socially accepted as something to help relax and something to help. Whereas there are actual dangers to it. So, what are your thoughts, Dr. Oge?
Totally. I mean, cannabis as well, nothing is innocuous, and cannabis is not regulated. So, a lot of times when you are rolling up that spliff or blunt, you're mixing it with nicotine anyway, or tobacco. So, a lot of times, so that you're still getting the dangers and the tar from the cigarette smoke. Even if it's just cannabis alone, at the moment, it's not regulated properly in the UK. So, you don't always know what you're getting. Again, it's affecting all different neurotransmitters in your brain. So even if that initial effect can be one of calmness, the pain relief they say, you don't know what other negative effects are happening. Now we are moving more and more to an era where CBD or cannabinoids are made legal, and they are obtainable for certain health conditions like chronic pain and even epilepsy, retractable epilepsy, and other conditions. So there are benefits, but it needs more research, more regulation, so that you can be sure what you're getting is safe. So it has to go through all our health, medicines, health regulatory agency to make sure that we always, as a medic, weigh up risks and benefits. So if someone, say, has a chronic pain condition and CBD or cannabis can assist with that, you want to make sure it's a form that doesn't have all these other chemicals that we've also talked about, and that can really aim to benefit, and the risks are lower because the benefits will be helping that chronic pain. So always it's a way up of risk and benefit. But if it's just for recreation, then that regulation is needed. We know there are areas in the world, California comes to mind, where it's now been legalized. It's no longer illegal, but done in a certain way. So as always, you just always have to be careful. It's never sometimes about the agent, the pure agent. It's about the additives and the extra stuff that makes it marketable, that can then lead to the health issues in the long term. So we just have to be careful. Anything that affects the brain in that way may have its negative effects as well.
Yeah, and also when you're smoking something, you're still smoking into your lungs. So,
So the lung injury,
yeah,
exactly, is a
I
real thing.
actually remember as a medical, when I was a medic in hospital doing hospital medicine, seeing a young man who literally had holes in his lung that
Yeah,
had been created, so very severe COPD, and he was a cannabis smoker,
yeah,
as opposed to just cigarettes. And he was
yeah.
really young, he was under 40, and he had the lungs of someone who was much, much older, and it was going to be a life limiting condition. So it's not just about the impacts on the brain and mental health. And, there's also impact from smoking that can impact the lungs and lung health because of all these. I mean, we've talked about some of them, the complications of lung disease, as well as increased risk of many different cancers that can come from smoking. So obviously we don't want to approach this in a judgmental manner, because I know that for a lot of our communities, cannabis is sometimes even seen as a religious experience, but we have to really think about what we're putting in our bodies and why and what it can do, and
Yeah.
therefore think about it, more laterally, as to
So
its impact.
one of the images that really stick from anatomy class. So the question about the placenta being gritty and ugly. I remember seeing lungs, lungs from a smoker, someone who had smoked during their life. So feeling it and the tar and the darkness compared to a pair of lungs from someone who hadn't smoked. And so that physical change. And then the thought is that things like vaping, that acute lung injury, we're seeing it, as I mentioned, it's increasing exponentially. And even shisha, I haven't even mentioned things like shisha as well. That physicality of inhaling smoke really can cause direct lung injury to your lungs, your throat, your mouth, your throat, your lungs.
Yeah, no, thank you so much. Someone's asked that why does stress and mental health play in someone's decision to smoke or vape? And I think this is a really important question because I talk
Mm,
about it. I do a lot of advocacy about obesity and eating. So all these addictions, some of them are tied, because it's similar pattern as to, why people feel stressed, and then the natural response is to do something that could potentially harm. So whether it's overeating or alcohol intake or smoking, and how can we break those patterns and those narratives? So it's very much tied to, can we find alternative healthier ways of managing that stress? So for example, I've had a bad day. What do I want? A cigarette or a burger or a glass of wine or a shot of vodka, to try and reduce my stress. But is it actually reducing my stress, or is it harming me? Could I do something else? For example, I've shared my own journey with eating. So it's not smoking, but there's parallels to it. Like
yeah.
I've struggled with overeating in my own personal life, and when I feel stressed, it gets worse. So what I've learned to do now is actually, rather than, firstly, I don't buy a lot of the high risk foods. I just don't buy them, so they're not in my house. And then I found an alternative thing to do. So I might listen to music, or I might go for a walk. Um, to just And when I've just gone outside and spent some time outside, I feel so much better. And when I come back, I don't feel like necessarily eating what I wanted to do. So again, like Dr. Oge, do you have any tips on how you can what that relationship and how we can break it?
I think that's where having that kind of almost a counseling, like I talked about, that's one of the intervention, to go through your why, go through your habits, go through the reasoning why, because there really sometimes there's an underlying issue. There may be stuff from the past, there may be unresolved things that people need to get through. But with the smoking, the habit of leaning for cigarettes when you feel stressed or under pressure, or it's a way of taking a break, say, there's always the people that went out for cigarette breaks that we know of. So other ways to do that. There's no reason why you still can't take a break. We should all be taking regular breaks from our screens anyway. Walking outside is huge. Nature, making sure we're improving our sleep. So there's evidence as well that that can really help with our decision making. Trying to eat as well as we can. Maybe finding people that you can hold you accountable, that you can talk to at those moments if you feel like picking up that habit that you're trying to break. So it's a mixture of will, but that support as well is really crucial because it is a very difficult thing to do alone, and the beating yourself up. So someone mentioned about failure, maybe you failed to give up, you've tried and you feel like a failure. But someone said that don't waste any of that pain, don't waste any failures. It's all about, so what did I learn from this? What did I feel that made me that I can improve on next time? So it's really about learning from when things haven't worked out and then trying to do something different going forward, knowing that the end goal is to stop this thing that is causing you and potentially your family and people around you so much harm.
Thank you so much. That's so powerful. Now, there's quite a few questions about vaping. So we've got one
Mm,
from Dr. Ngozi Ediosagir, which is she's very concerned about
yeah,
the increase in vapes in children and the use of
yeah,
flavored vapes. And she's basically wanting us to really say about vaping not being in an innocuous thing. And someone else has said, seen a lot of youngsters picking up vapes like it's nothing. How do we
yeah.
stop the next generation from getting hooked? And someone else has said, my GP says smoking is worse than vaping. But is vaping even safe in the long term? I hear so many mixed things. And then
So
this
yeah, no, go on.
no, I was just going to say this really lovely question is saying, I've tried quitting vaping so many times, but the cravings always get to me. Any tips
Yeah,
that actually work? So it's quite a few
no,
vaping questions. I can
yeah,
repeat
vaping.
them.
No, 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 that's good. Vaping is the new, I think it's the new danger. And I think long term, we'll be talking about vapes potentially the same way we're talking about smoking. We need to be really, really careful. We've all seen the proliferation of the shops with the bright, attractive devices that are, developing all the time, different flavors, hugely. The addiction bit is still the nicotine, but then they add all these extra bells and whistles to make it attractive, and we've seen an exponential rise, like I mentioned in the presentation, in our teenagers in particular. It's the new cool thing to do. Before it was the cool kids outside hiding their cigarettes. Now it's the vaping. It is going to be an epidemic that we need to really be careful about. I think the main way to really tackle it is the law, legislation. We need to be really hard on it, as we are with cigarettes. We need to make it less attractive. So all the bright colors, all the different flavors, I believe need to go. It seems like it's a fun, innocuous, harmless thing to do. It isn't. Now, if you are a heavy cigarette smoker and you're looking for aids to help you stop smoking, so vaping contain less chemicals, still contains chemicals. There's now more evidence of direct lung injury that may be more severe than cigarettes with vapes, but it's less chemicals, less tar. So if it's about a step with the end aim to stop smoking and vaping completely, then I'd say someone who's a smoker and smoking cigarettes, then going to vapes is a lesser evil at the moment. But the idea is not to stay on vapes indefinitely. The idea is to let it, like nicotine replacement therapy, let it help you with all the other advice, counseling, your why, all the other building good habits. It's not just one thing, it's a whole toolkit of strategies to then the end result is stopping smoking and inhaling chemicals, full stop. But I agree, the addiction is real. And what is the main addiction is still the nicotine in the vapes. That's the active ingredient. All the flavors and the things that make the smoke go round more, they're all added things to make it attractive and to get people hooked on them.
Yes. And really getting rid of that nicotine addiction, it's very, very difficult. And saying tips that actually work, I think the the challenge is what's going to work for you, and this is why help can be really beneficial,
Be
because
personalized.
it has to be personalized. Because we've heard from Grandma Sheila, she tried different strategies, and then one day she said, I'm going to go cold turkey, and she managed to do so. You know, how she did it, she obviously she used her own spiritual journey. But there's loads of different strategies. Can you use nicotine replacement? Can Champix, so many different ways in which you can go to a stop smoking facility to see how they can help you with your own personal journey. And I would always say, don't try when you've got a lot of stressful things on. You want to try at a period in time where as in to quit. You want to try where things are kind of not stressful, where things are kind of unbalanced, so that you know that it gives you the best chance of stopping smoking, and you set a date, and then you get
Yeah,
the support and help to do so, as Dr. Oge has said. But no one is denying that it's really hard. It might take several goes of trying, but as Dr.
absolutely.
Oge says, with each go you learn something, and that can then help you with the next go. But don't give up,
Absolutely.
keep trying, and you will get there in the end.
I
Now,
had another
someone,
quick one to say, sorry, about vaping and then our children. Because, like I said, vaping, some may suggest it if you're a smoker already as a step down, with the end result giving up completely. But the real concern is that our kids and our teenagers are just jumping to vaping. They've never actually smoked, because smoking is not something that's in their remit as much as it was maybe when we were teenagers. So it's a real issue, and that's definitely dangerous, because the vaping can cause direct lung injuries, which we're seeing more. Our respiratory lung specialists are seeing that more. So we absolutely have to encourage our children, teenagers, that this is not something that's harmless. And someone mentioned about people find it easier. She works in a drug facility. People found it easier to come off heroin than marijuana. People think it's harmless. There are risks associated with all these drugs that ultimately alter our brain chemicals and the way our brain works, and can cause direct injury to our lungs and other organs.
yeah, no, absolutely. Someone's asked, and I think you've kind of alluded to this a little bit about sleep, but she's asked,
Mm.
I wonder, can nutrient deficiency and lack of sleep be a root cause of some cravings? So, for food, smoking, etc., could eating more protein to keep us fuller for longer help?
So that person has clearly got good insight into this. Yes, yes and yes. So that's why I go back to the whole basket, the eating the rainbow, eating whole foods, moving. Sleep, I didn't mention, but it's increasingly, some people talk about lack of sleep is the new smoking. It's just as bad. Lack of good quality sleep as well. It's not necessarily the length of sleep, it's making sure you are sleeping good quality. So all of that can help with weight loss, with trying to give up addictions like smoking and other drug use, alcohol as well. So it's really important, like I said, to really look at the whole picture. It's not just the one thing, it's trying to do a little bit in each area so you can be as whole as you can in all areas.
Fantastic. And someone has asked, I think you've kind of, said you believe in this, but should employers or public places, so like the government, have stricter policies on vaping? And they've also asked, have you ever seen a successful anti-smoking or anti-vaping campaign? What made it memorable?
So for me, the main, like, the two big things I think that has stood out to my thing was charging 5p for plastic bags. All of a sudden, people are carrying there's about changing behavior because there's a consequence, yes? And the banning smoking indoors. That I remember clearly. Maybe it's about me selfishly not liking the smell of smoke in my braids and not having to deal with that. But it made a massive difference because it changed behavior like almost overnight. So the law and the government has a big role, but we have roles, in our circles. And I think it is important, because sometimes it can come from a place of judgment, and people do feel very stigmatized. But we need to do it from a place of actually, we want us to be thriving and hold together. That peer support is huge. If every one of your friends, like our grandma Sheila said, if all your friends are doing it, it's just part of what you do. So really making it normal that it's okay not to. But even if you do, we can support you in taking the steps so that you make other choices.
Fantastic. And I actually remember because when that change came in, I was so relieved. And then
Mm.
when I went home to Nigeria, which is where my family is from, and I went into a club and I started I'm like, "Oh my gosh, you don't
Yeah,
think about how much it's changed, right?
it's
How much it's
changed.
changed your
Yeah.
life." And also your experience of the going out in itself, because it's
Mm.
just not as smoky and not it's just not it's just much better for everyone else. Your breathing feels better when you go out and stuff. So having that change, it really drastically changed things, I think, here.
Yeah.
And when you compare with other places where that law is not in place, you can really see the difference. No, thank you so much. Were you going
Quick
to say
question with
something?
the, yeah, just we've all been there with the peer pressure as teenagers as well. So just be there, be open, hear out your kids, and just provide safe spaces for them to come to you to explain what's happening, with in terms of maybe vaping or having friends or thinking that it's something that's harmless. Have those honest conversations so they're aware of the dangers for the long term as well.
Absolutely. I think I actually remember being like a teenager and thinking I was going to try it. Um
Yes, we've all been there.
and
Absolutely.
and but the thing is, literally for like 3 weeks after just trying one cigarette, I could feel my chest not being happy. And that was what put me off. But at the end of the day, sometimes even if they don't even really like it, it's because a lot of their friends are doing it, or the vaping and stuff, even if it doesn't make them feel that good, and then it then becomes an addiction. So even just having like an open, honest question, tell me the truth, have you tried it? How did it really
Yes.
feel? Let's have a
Share your
conversation.
own honest
Be
conversations as well,
honest,
because be honest.
like,
Yeah,
and share. I tried it, and like literally having that honest conversation with our young people and not
goes a
having
long
a
way.
judgmental approach goes a long, long way.
No, totally agree with that.
Yes, no. So, this has been a really fantastic chat. Dr. Oge, thank you. And thank you for just being so honest and open and really passionate about breaking down stigma on this topic. Thank you, Grandma Sheila, for sharing
Mm,
your story, which was so inspiring. And, thank you to everyone who's joined and asked questions. It's been a very stimulating and lively conversation. And I think the big take homes is that firstly, let's break down this stigma and it's like any addiction. At the end of the day, we need to break down the stigma, but we need to also give people the opportunity to find out what else can they do, how can they get the support. And Dr. Oge has really lined it up. The NHS has stopped smoking services, and for those who is smoking cigarettes, and that's the big issue, there's also NHS drug and alcohol services to help break these habits. We want to make sure that our teenagers, our young people, are not getting the wrong image that vaping and the colorful vapes are harmless. They are not harmless.
yeah.
They are harmful, and we want to have these non-judgmental conversations, breaking down the information that all of these things have consequences for future health. And yeah, at the end of the day, there's many ways to overcome these issues, but it's going to be personalized, and getting that help and peer support, doing things that are helpful for your body, like eating well, movement, nature, sleeping, all these other things are going to help. So thank you so much, everyone, for joining. We're grateful. Um, and Dr. Oge, do you have a last thing to say?
No, just thank you for listening. It can sometimes feel like a topic that isn't as relevant, but it really is. I'm really glad someone asked the question about cannabis, and we spent some time about vaping, which, like I said, is the new kid on the block. And I think we just need to be aware that these things are not without harm, even if some feel there's a medical need for it. So vaping can be a step down from actual smoking, but be wary of people who just start vaping from scratch, and how it's just as addictive and can be very difficult to give up. So the best preventative that we can help our kids and teenagers is not starting at all. And then if you have started, there is help out there. Ask for help. Don't feel alone in that, and keep trying. That's all. That's the great message that was said. Keep trying, even if the first efforts aren't successful. And just think about your overall health for yourself and your family. In the long run, it will be of benefit to you.
Wonderful. Thank you so much. And on that note, we're going to be handing over to Sam.
Thank you very much, ladies. That was a great session. Thank you very much for going through, the actual issues that people within my generation and younger do go through in regards to vaping. And I'm glad that you talked a little bit about shisha and cannabis as well. That's something that some people think doesn't cause harm to them, but actually does cause harm in the long run. I'm going to just quickly share some slides on what's going on within the community and what's going on within Khan for you to just be aware of. So just bear with me. I'll be very quick. Then we carry on with the rest of our Saturday. Okay. Okay. We'll be here same time next week to talk about fibroids. It's something I don't have personal experience with, but I'm going to be willing to learn, and I hope that you will be too. Happening same time, same place, same link. Please do share it with your friends and family, and we do look forward to learning more about fibroids and how that affects people within our community, and also to improve our health literacy. So coming up on the 22nd of May, we will be celebrating Africa Day at the University of Greater Manchester. This year, the theme would be focused on accelerating business growth and technology. So there's going to be lots of workshops there. There's going to be opportunities to network within amongst yourselves and with attendees. There's going to be opportunities to network with, strong entrepreneurs and people that are upcoming, people that want to be entrepreneurs. So if you are looking for a moment to learn about business and how to expand that and grow, please do join us on the 22nd of May at 10 a.m., sorry. 10 a.m. to 3 p.m. If you do have any questions or you do want to know more about this, do email africaday@khan.org.uk, and I look forward to seeing you there because I'll be there dressed in my Nigerian outfit and ready to celebrate Africa Day and my heritage. If you're a business owner or your organization looking to share your product or services with the community, please do scan this QR code or email africaday@khan.org.uk. This is a free event where you'd be able to share what you are doing with the community. So please do come and use this opportunity to, spread the word and raise awareness for your business or organization. I would look forward to seeing you there. So on the 12th of July, we will be celebrating Black Healthcare Awards in London at the Park Plaza. There's the opportunity again to celebrate the Black healthcare professionals within our network or within your network. And also, as we know, the Black healthcare individuals that work within NHS or the private sector are the backbone of healthcare within the UK. And sometimes we don't get enough recognition. Last year was amazing. And that was the first time where I fully felt like, wow, I didn't know that there were so many cardiologists, there were so many dentists that are Black. These aren't people that you get to see unless you're within that space. So there's an opportunity to be within the space, network with them, speak with them, and celebrate those that are doing fantastic, fantastic work. And this year, I'm looking forward to seeing who will be getting recognized and who will be getting celebrated by just everyone that's going to be there clapping and cheering amongst themselves. So please, if you do want to get a ticket, please scan this QR code or contact us at Khan and we can give you a hand in getting these tickets. So Safe Steps is a free, inclusive sexual health service for people within Lewisham, Lambeth, and Southwark, where you'd be able to get some confidential advice, peer support counseling, some assistance with HIV and STI testing. And guys, this is something that we don't want you to shy away from. If you do need some support with this, there's always support available. We here at Khan are champion health literacy and champion that people take care of themselves and their network and their community at large. So please, if you do have any questions or you want to be part of this or you want to push Safe Steps further, please contact team at safesteps.london. So workplace discrimination is something that, some people do experience and they might not even know that they're experiencing it unless they are told or unless it's pointed out to them. That's why during our family advocacy session on the 15th of May, it's a free event again, happening online on Zoom. Scan this QR code to learn more about this, and you get to learn what actually counts as discrimination or harassment and, the legal things that you might need to be aware of to protect yourself as an employee. Because yeah, we're in a country and we're in a place where you do have rights, and it's good to be aware of these things wherever you are working. If you do want more information, please do contact family advocacy at khan.org.uk. We look forward to seeing you. It's going to be happening in a few days and it's going to be from 6 p.m. And please do come with your questions and be open-minded. So Maternal Mental Health Week was from the 5th to the 11th of May. It's just almost coming to a close. But again, we are calling on anyone that's listening to this presentation or listening to this talk today. If you are struggling with your maternal experience or you have nobody that you feel that understands what you're going through and you do need some support, please do not suffer in silence. We do have culturally competent counselors here at Khan, and if you do want to talk to us, please email rosalind@khan.org.uk. We do also have physical drop-in sessions available on the 1st and 3rd of Mondays of every month at the location M18 7NE. That's in Gorton in Greater Manchester from 10 to 12. So please do take up this opportunity to come get some support. Please do not go through these experiences alone. We're here to support you, and we don't want you to suffer in silence. And lastly, we are calling on any nurses or midwives looking to give back to the community. Please do join us in, providing some time and support to improve health literacy for our community, which is very, very important. Attending talks like this and also, taking part in health screenings. This year so far, we've offered over 200 plus free health screenings. And I bet you're thinking, what do you get back from this? Well, you get to help reduce health inequalities, you get to connect with people with vital health services, and also just provide support for people in the community who may not see Black nurses or who may not have the opportunity to speak with Black midwives, which, as I said before, is very important to us and very important to us as a community. So if you do want to get involved, please scan the QR code, or for more information, contact scholar@khan.org.uk. Thank you very much for listening to this presentation today on vaping and smoking, delivered by Dr. Oge and hosted by Dr. Itunnu. We do greatly appreciate the time you do spend here with us. And if you have any questions, please contact us at health@khan.org.uk. And thank you very much. See you next week, where we'll be learning more about fibroids. And bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@khan.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Thanks, everybody. We've finished our session of the Health Hour. See you all next week. Thank you.